Good morning, everybody. How are you? My name's Terriquez-Kasey. I work in the Decker School of Nursing, and I'm going to talk this morning for a few minutes on global health and why to reflect on healthcare. I think it's, as the doctor just said, a major issue is environmental health, but also the issues surrounding all of that. That includes social, cultural, and what I consider a major problem is the public issues that go around the world in regards to supporting healthcare. So I say the word to you: Ebola, chikungunya, measles, dengue, and then everybody kind of sits back and goes, yeah, we've heard all of this before. The reality is that few of us have heard all of it, and unfortunately we are seeing a reemergence of this. The one I left out that's probably very, very important to us is also trauma, something that we fail to look at as a global problem as well. Because of the trends noted, we keep thinking and alert to changes in diseases. Last June, I headed up a team university to the Dominican Republic of some nursing students, and we were prepared to take care of elders, ourselves, anti-malarials. We were educated about food and water borne diseases. We were educated a little bit about some of the issues to expect, but we were not necessarily educated about chikungunya, and we walked right into it. And I talk about that only because the impact that these type of diseases have on a health system that is already having problems just creates more. And we've seen this repeatedly in Haiti with the cholera epidemic that spread to the Dominican Republic, and with dengue fever that has now spread as well to many parts of the lower United States. We are seeing a reemergence of some of these tropical diseases along with a spread across the world, and it appears that we're not quite ready for it. The diseases that are reemerging, we're seeing measles here in the United States, polio outbreaks in Israel and the Middle East, SARS in Asia again, and dengue fever in China mainland, the chikungunya in the Caribbean and the Polynesian Islands, and in places that we hadn't seen it before. The Ebola in West Africa is just one of the major diseases that has had a tremendous impact on our world. Now, it became very, very evident that we thought we knew we were ready for outbreaks, but I sometimes wonder whether we, as a large focus, are ready for the outbreaks. And I'm talking about from a physician and nursing perspective. From a pharmaceutical perspective, we're also not ready because we don't have medications for some of these outbreaks. We don't have things to treat well. And we don't have vaccinations for everything that we'd like to have vaccinations for. Do we have a long way to go? Absolutely. So why do we need to discuss the need for arming health departments in poor nations? We discussed Ebola, and we saw the experts with PPE here in the United States, and we said, wow, we were caught off guard, weren't we? And the other thing that goes along with that is that here you had very poor countries trying to treat an outbreak of Ebola disease that were not prepared, that needed help from the outside. And that is true every time that we see distinct disasters going across the world. So how can we help poor countries help themselves? I look to the situation and think of three major concerns that we discuss in world health. We need to take down some of our political barriers in order to focus on the diseases at hand, including trauma. We also need to focus on the global poverty that feeds diseases and allows them to go on unchecked. We need to mitigate diseases in order to protect people around the world. And then we hope this panel today will open up the discussion of global health. And that's our intent today. Things we need to focus on: providing basic health care to the poor, controlling vectors that carry diseases, educating young medical and nursing students to assist in providing health care in poor countries, developing long-term plans to mitigate climate changes, and responding to disasters with adequate long-term recovery plans to assist countries in the recovery efforts. And we can see this happening over and over again in every country around the world. This is not just a problem in one country. This is not just a problem in Africa. This is a problem that goes around the world. And when we say global, we truly mean global health. The issue is at hand. Can we change what we are presently doing and make it better? Many of us need to work together. The need for us to mitigate climate change is critical because it is also changing the number of disasters that we are seeing, the spread of mosquitoes in different parts of the world. We're seeing the results of major disasters across the world in the last 10 years, and the result is increased poverty, increased hunger, and increased lack of health care for the masses surviving the disasters in their regions of the world, whether it be in the Philippines, in China, in Africa, in Asia, or in the Middle East. Here in the United States, we're still seeing problems with us providing basic health care to the poor. So we can discuss some of the programs. What do we need to consider? What do we need to mitigate? When I talk about mitigation, I'm talking about can we prevent things? And yes, we can, but only if we work together at trying to do that. How will we help educate and train medical workers and nurses to care for these different populations throughout the world? We are not quite ready for that, and we do not have all the healthcare workers we need around the world. Consider the problem at hand. It's not going to go away because we wish it to go away. Teaching others to care for themselves should be our goal. Teaching others in other countries to care for themselves is our goal. Thank you very much.